Good morning. I'm Doug Bridges, Chair of the Cleveland County Commissioners, and I'd like to welcome everyone that's watching this morning to our COVID-19 Community Forum. Today, we have Tiffany Hanson, our Health Director, and Brian Epley, the County Manager, and they're going to answer questions that you may have about the COVID-19. We started hearing about this back in last February, nearly a year, and I myself was sort of skeptical and thought, this is not going to be a very big deal. And then it went on, and then I thought, well, here comes summertime. It's going to be like the flu. It's going to go away, but it just kept getting worse and worse. In fact, the 1st of January the 2nd, I'd been feeling bad for a day or two and ended up going to the ER and spent the night in the ER because there weren't any rooms in the hospital. Turned out I had COVID-19 and had to stay about 4 or 5 days at the hospital. And as I understand, it's probably going to be a month or two before I'm really back to normal. But this is really serious situation, and as a county, we're working very hard. All our county employees working across departments, and we're trying to give these vaccinations out as we get them in. Everybody's working hard. I'm really proud of our county and everything that's going on. And I'm going to turn this over to Brian Epley, our county manager. And
thanks, sir. Just to build on what Commissioner Bridges just spoke to, we're now 10 or 11 months into a generational, hopefully something that we only all have to live through one time. And COVID-19 remains the top priority of Cleveland County government, not only through really focused on communication and education, also in testing, and now as we're beginning really to hit our stride in the vaccination process of managing through. Just a little bit of housekeeping from my perspective, and then I'll ask Tiffany Hanson, our Public Health Director, just to run through a little bit of data that would help inform each of you out there, and that you can share with your friends and family about how things are going in Cleveland County, and a little bit about the strategy of how we hope to efficiently and equitably administer the vaccination, recognizing that we have a lot of folks to communicate with, a lot of folks that are eligible and that we want to prioritize. So momentarily, I'll ask her to do that. I just wanted to start by thanking each of you for taking a little bit of time out of your day and morning to jump on this forum. At the end of the presentation, we'll take Q&A. There should be a box on the right-hand side of your screen where you can submit questions via text, and we'll get to as many of those as we possibly can in our 45-minute time frame. Also want to just communicate that it's going to be a commitment from this team to do this type of forum every 14 days, so every other Friday beginning today at 9 a.m. So anyone in the community that you can share this with, anyone in the community that you feel like needs this type of information, please let them know that this is a good opportunity for us to hear from a grassroots level what is going on in the community so that we can make appropriate adjustments to the plan. There's obviously no type of perfect strategy to ensure inclusive communication, but I think what's the priority is to make sure that we have a platform that allows for everyone's voice to be heard and for us to share information. Our goal is for our team to share everything that we know, and we think that'll help have a more of a coordinated approach as we move forward. A couple of consistencies that you're going to hear through Tiffany's presentation, and a couple of things just to have in your mind as you're watching her walk through is number one, the vaccine that's being administered in Cleveland County is at this point solely the responsibility of Cleveland County Public Health. You may have heard in other communities where the hospital system, for us that would be Atrium, may be participating in public vaccinations, and they are regionally in pods in other counties, but our county and our team has a really strong relationship with Atrium leadership. We are thankful for that. We communicate with them regularly, and at this time they're not planning to do public vaccinations in Cleveland County, and that's been a coordinated strategy since the very beginning. Secondly, the prioritization framework, meaning who is eligible for the vaccine and at what time. That isn't something that's determined or drafted locally. You can see that prioritization framework. It'll be in Tiffany's PowerPoint, but you can also see that by going to ncdhs.com.org and looking at that. But that's something that through the North Carolina Department of Health and Human Services and through the governor's office, they prioritize. And I'll point out that that changed a few times. Vaccination distribution first started flowing through North Carolina the week of December the 15th. And at that time, there was a high level of prioritization on public health and hospital workers and first responders, public safety, and that has remained consistent. What's changed on multiple occasions at this point, and very rapidly, honestly, is what has been considered Group 2 and Group 3. Originally in December, when the governor's office and Secretary Cohen's office, who's the North Carolina Health and Human Services Secretary, had a high prioritization on chronic disease, which then transitioned to folks above the age of 75 and now to folks above 65. Just know that at a local level, our goal is to follow that framework because the vaccines that the state gives us are dependent upon that. If we act outside of that framework, we are risking vaccine allocation, which we know is a danger and a risk to our community. As that changes, we want to communicate with you. As it relates right now, folks who are eligible are those Group 1A, public safety, healthcare workers, long-term care workers, and Group 2, which would be anybody over the age of 65 or older. And there's about 19,000 of those in Cleveland County. So it's a little bit of a challenge to communicate those type of changes. It's a little bit of a challenge when you have folks from our community out of that 19,000 that may be getting vaccinations in other places. But just know that our goal is to, again, efficiently and equitably make sure that we're being inclusive in our communication. And that as we receive dosage allocation, that we're expediently getting that out into the community as quickly as we can. As we came in, again, Tiffany will mention this, as we came into this week, since the 15th of December, when we received our first allocation from the Health and Human Services Department at the state level, we had received 1,300 vaccinations in Cleveland County. And again, coming into this week, we had administered 1,250 of those, which is 96%. We receive our notification only about a few hours before it goes out. And so, again, the three things that I would just say is communication is key. Know that we're trying to be as expedient as we can. The prioritization framework is determined at the state level and to this point has been very fluid. And then lastly, as you'll hear repeatedly over and over and over, and it may be the most important takeaway from this entire first forum, and that is dosage allocation is the most important thing and is the prime variable that will determine our effectiveness in getting this vaccine out to the community. So at this point, I'm going to ask Tiffany to run through a few pre-prepared slides. She'll go into more detail on a lot of the points that I just mentioned, and I look forward to trying to answer some of your questions when she concludes. Tiffany?
Thank you. As Brian mentioned, we're just going to go through where we are as far as COVID-19 in Cleveland County and our vaccination update. So first of all, here's our most recent numbers from yesterday. We had 8,767 cases in Cleveland County as of yesterday. Active were about 557, so this is about 6.4% of our cases. Deaths, unfortunately, are at 174, so about 2%. Estimated recovered cases are about 8,036, so 91.6% of our total cases. For vaccination, as Brian mentioned, this is the latest framework from NCDHHS, updated January 14th. So Group 1 continues to include our healthcare workers and long-term care staff and residents, which have been consistent across kind of the three changes that we've seen. Group 2 is where we've seen our largest changes. This now is older adults 65 and older. Group 3 are our frontline essential workers. Group 4 are adults at high risk for exposure and increased risk of severe illness. And Group 5 is anybody else who has not been previously vaccinated. A closer look at each one of those phases and what that may look like. Group 1, as I mentioned, are healthcare workers and long-term care staff and residents. These could be individuals working in hospitals, long-term care facilities, public health, pharmacies, home health, emergency medical services. Group 2 are older adults. So as mentioned, this is where we've seen the largest shift in this updated framework. These are adults age 65 and older, regardless of chronic condition. Group 3 are frontline essential workers. So these are our first responders, our education staff, agriculture workers, manufacturing, correction workers, U.S. Postal Service workers, public transit, and our grocery store workers. Group 4 are adults at high risk of exposure and increased risk of severe illness. This is anyone ages 16 to 64 that have a high risk medical condition that could increase their risk of severe disease from COVID-19. For us, we carry the Moderna vaccine, so this is actually 18 to 64. This would also include anyone incarcerated or living in a group living setting. Essential workers include transportation, food services, construction, IT, energy, public safety, water and wastewater treatment as well. And then group 5 would be anyone not previously vaccinated in any of the groups above. How are we going to vaccinate? So the first thing is really understanding who falls into the current group that we're vaccinating. As we mentioned, we're on group 2, so this is 65 and older. Utilizing a variety of data sets, we've been estimating this around 19,000 residents in the county that fall into that 65 and older category. We want to utilize multiple communication platforms because we recognize that there are some barriers in the county. So one of the priorities that we're utilizing is mail. And we're really assessing this for a couple different things. We did our first clinic yesterday and realized that this helps us prioritize Cleveland County residents, along with really have targeted geographic approaches. The downside to this is it really gives us some uncontrollability on people actually coming in and taking advantage of those allocations. The other platform that we're utilizing is a phone and email based, so you can call in for pop-up vaccinations as doses allow and schedule an appointment for those clinics as well. And the last point on how we're going to do this is, so our plan is 750 vaccinations distributed 3 days a week as doses are allocated to us, which requires us to commit about 28 staff, 6 days a week, which include 3 booster doses as well. When are we going to vaccinate? So in December, I was lucky enough to be able to present our original plan to the Board of Commissioners. In January, we're in groups 1 and group 2. By March, we're hoping to be to group 3 as dose allocations allow. By April, we're going to be to group 4, dependent on dose allocations. And by May, we're going to be to group 5. Where are we going to be vaccinating? So we utilize a point of distribution model. We utilize 4 primary sites. This includes Fern Middle School, Kings Mountain Intermediate, Crest High School, and Cleveland County Public Health Center. Inventory. So this is our recent inventory as of last week. 12/23, we were able to receive 500 vaccines. 12/28, we received an additional 100. January 4th, we received 500 vaccines. And January 11th, we received 200, bringing us to a grand total of 1,300 vaccines. Cleveland County Health Department administered 1,250, bringing us to a grand total of 96% distributed. In order to determine our allocations, North Carolina Department of Health and Human Services uses a 4-pronged approach, so determined based on our population, our hospital capacity, our highest daily doses administered, and our inventory on hand, which we just recently learned this and are now managing to those parameters. Upcoming inventory management. So for this week, we were fortunate enough to have a partnership with Atrium, and they reallocated about 2,000 doses to us, along with our 500 dose allocation from the state. We were able to host a drive-through clinic at Crest High School on 120 for 750 participants. This was done by phone and email appointment. Yesterday, we were able to host a drive-through clinic at the health department utilizing our letter platform. Today, we're also hosting 150 additional appointments at the health department. On Saturday, we'll be at Kings Mountain Intermediate with 850 letter recipients, and then on Monday at the health department for 250 additional phone appointments, bringing us to a grand total of 2,500 appointments, 100% administration. In summary, I really just want to focus on what our priorities are as we continue to strategize through vaccine management. So our focus being on communication and transparency, continuing to regularly meet with the Board of Commissioners, updating our faith leaders, holding these forums with the community, and really just keeping everyone informed that really our priority is on vaccine effectiveness and on allocation allotments. And so we know these are extremely limited. We find out about 36 hours prior to receiving vaccines what our plan is going to be for the next week. And then also based on our framework, we are prepared to administer upwards of 2,000 doses per week, dependent on the number of vaccines that were allotted. And the last thing is volume really is a priority, and patience around our planning and our structure is paramount to success. So we've seen historically over the last 4 weeks about 65% engagement rate at our clinics, and each one of these doses require 2-dose series. So meaning we're going to have about 130,000 contacts over the next 160 days to stay in compliance with our targeted approach and our calendar being January to May to get through all 5 groups. So this really allows us to average about 812 contacts per day in order for us to achieve that. A couple additional things I just wanted to mention before we take questions are the vaccination phone line that we publish weekly, or as pop-up clinics allow, are only staffed at the specific times that we put out there. And so if you continue to call, you will get the no appointments available message. And then our updated weekly vaccination table will actually transition from Fridays to Tuesday because NCDHHS has shifted their vaccination weekly tracking as well. So theirs runs Wednesday through Tuesday. And so for us to be more accurate, we want to make sure that we're reflective of that entire week. And so our updates will now happen on Tuesdays.
So just one other couple or a few other thoughts that I had again before we start taking some questions. And do we have questions coming in?
Yeah.
Good. So out of the most important takeaway I still believe today is to understand that vaccination dosages are limited, and that's going to drive the timeline. So as Tiffany pointed out, if we had adequate doses on hand, and we think that's 2,000 a week, we think that we can move through the prioritization framework in that May-June timeline. But if we're only receiving a couple hundred from the state, obviously that's going to drag that out substantially. So I think that's important to remember. I would also encourage you, and this has little to do with our administration strategy and much more to do with just general knowledge. I would encourage you to really be positive about the vaccine. I've heard a lot of people question the timeliness of how it was developed. I'm certainly not a public health or a clinical expert, but when you dig into the development, the 2 vaccines that were authorized under the FDA's emergency authorization use are Pfizer and Moderna. Both of those have gone through the exact same stringent process that a vaccine may take 5 years to be approved. Both were tested on over 30,000 subject matter folks and had met the criteria and the compliance metrics to be approved. So it's really important, I believe, to have the fact pattern in an accurate way that demonstrates that it wasn't rushed through, it's not unsafe, and really taking the vaccine, we believe, certainly for people that are at higher risk, is the right thing to do. And I would encourage each of you to really think through that and try to be motivated to communicate that with friends and family. Now, the second thing I would say about the vaccine is we recognize that in South Carolina there are lots of distribution points. We recognize that many of you may be going online and trying to get appointments through the Atrium website that may send you to Lincolnton or one of their 5 distribution points. At this point, I believe that scheduling for that is all the way out in April and May. Even for folks who qualify for Group 2. What I would point out is, again, of the 2 vaccines, Pfizer and Moderna, whichever vaccination point you start with. So if you go with Atrium and you begin with Pfizer, it is critical that your booster is also Pfizer 21 days later, meaning if someone were to be vaccinated in Lincolnton and then try to get their booster with the public health department, since we're using a separate vaccine, that is not the appropriate way to do that. It's critical that folks stay with the brand that they begin with, and that you get that booster within the recommended timeline. For Pfizer, that's 21 days, and for Moderna, that's 28 days. Both of those, I believe, are critical to point out. And just a couple other things. If someone has already received their vaccine, that doesn't create instantaneous immunity. What we've been seeing is that it's about 57% immunity for the first 7 to 14 days on that first dose. And then depending on which vaccine you're taking, as you receive your booster, that's what gets up to that 94.5%, 95% immunity. And we're hopeful. The question's still out. Another question that we've heard often is this going to be an annual process? What's the level of sustainability with immunity? And we're at least at this point optimistic. The research is still out. The science is still answering that question. But we believe there's reason to be optimistic about long-term immunity, meaning that if, as a community, we're able to get to 70%, which would qualify as herd immunity, meaning 70% of our population has either developed organic antibodies by having the virus or by receiving the vaccination and the booster, that this virus will eventually run out of host and we'll be able to eradicate it in totality. So I think that's the goal. That's why we want to be so structured and so organized and get these vaccines out as quickly as possible. Know that our planning has to remain fluid. We're often making decisions when we only have a very minuscule portion of the relevant information, and communication is key in that situation. So when we say we ask for your patience, it's really because we're learning as you are. We want to hear your feedback. We want to get better. Tiffany talked about deploying two types of communication strategies, one being a U.S. Postal Service letter. We really think, again, she said that prioritizes Cleveland County citizens, and that's one of the things that's most important to us. What we've seen both in our community and in other communities is when it's simply an online registration or simply phone calls, you get folks geographically from outside our county. And proportionately, we want to focus and prioritize Cleveland County folks. We think we can do that with a Postal Service sent letter. We also think that addresses folks who may not be as savvy with an online platform or may have communication barriers. The takeaway and the downside of that is what we experienced yesterday, and that's that we only had about 50 to 60% of the folks who were invited to take advantage and capitalize on their allotted slot. So that level of engagement will require us to measure not only yesterday, but Saturday's clinic at Kings Mountain Intermediate, in which we've invited 850 folks via U.S. Postal Service, to evaluate both of those on a real-time data collection forum and make adjustments. Because, in order to vaccinate the number of folks that are going to be required, we have to maximize each resource, each pod opportunity, meaning that 50 and 60% turnout simply won't get it done, and we'll have to adjust the strategy if that continues. But again, can't thank everybody enough for being here this morning, and now I think it's an appropriate time to take some questions.
All right. There was a question I think Mr. Epley would be most appropriate to answer. How are the names and addresses of people eligible obtained? And once they are, how are priorities for appointment letters set?
Great question. So again, no perfect system. The platform that we've been using primarily amongst others, but the primary data source is from our Board of Elections and its registered voters. We're using the Moderna vaccine, which we know is only eligible for folks above the age of 18, which also aligns with eligibility for voting. We have about 68,000 registered voters in Cleveland County, and for each of those, we have name, address, geographic location in the community based on voting precinct. We know that it's not 100% accurate. There are some folks that have just moved here, some folks that aren't registered voters, and so based on some triangulation and cross-data references with 911 records and GIS and so forth, we believe it to be 91, 92% accurate. There's probably 6, 8, 9, 10% of folks that, somewhere in that range that may not be inclusive there. And that's, that's where the pop-up phone lines opportunity would really capture that. But again, I don't want to get too hung up on the letter system. It's just a way to ensure prioritization are given to our citizens inside our county, and to ensure that folks who may struggle with communication are included. And the other thing is really our phone for dedicated COVID-19, whether it was back to work letters or testing inquiry or inquiry about opening your business or vaccination clinics, it rang 2,000 times yesterday. And so you can do the math, do 2,000 phone calls a day times 5 days a week, divide that by the number of hours that one human being can possibly work, and you can see that it becomes incredibly frustrating for someone who's calling over and over and over and can't get through. Having a direct communication through U.S. Postal Service, ensures that everybody has the opportunity to be heard and to be considered. But all of those priorities have to be measured and have to be balanced with making sure that the vaccines that we're given are quickly rerouted back into the community, because as we learned last week, our inventory on hand and the highest number of vaccines that we've administered in one single day are variables in the equation that dictates how many vaccines we'll get the following week. So we have to prioritize getting more vaccines in Cleveland County. And the way that we do that is by having utilizing everything that we're given. And if the letter system doesn't allow us to efficiently do that, then we may have to transition away at some point. But we're evaluating that based on yesterday and how tomorrow goes. The prioritization based on the data sets inside that Board of Elections spreadsheet is simply aligned with the state's prioritization. So we don't pick that. We can easily sort that information based on age. And right now it's anyone above the age of 65 and older. And that's as of the end of the year. And then we've compartmentalized it into those 4 pods, Burns, Middle, Kings Mountain Intermediate, Crest High School, and the Public Health Department would be the Shelby location. And for some of them, we're doing alphabetically, chronologically A to Z, and for others, we're doing Z to A to ensure that that we're not just, that folks in one portion of the alphabet don't necessarily get overlooked. So nothing too scientific, just an effort to try to include as many people as we can and be structured and organized. And hope that answered that question.
All right. I think this question may be most appropriate for Ms. Hanson. This person has an appointment in March with Atrium, but will there be a way for me to possibly get one sooner in Cleveland County?
So if you are over 65 and fall into group 2, it is highly likely that you would either receive the letter from us as well as potentially have an opportunity to participate in one of our pop-up vaccination clinics. If you're able to get an appointment with Cleveland County before April or March or whenever you're scheduled for Atrium, I would encourage you to do so because I think we're moving a little bit more quickly. But if not, absolutely keep your appointment at Atrium and that ensures that you have it there as well. But I would encourage you to participate in the pop-up clinics and look for your letter in the mail if you're 65 and older.
I think this just needs a little bit of clarification. Why did you choose not to partner with Atrium? And I think that just kind of.
Sure. That's a great question. So that wasn't a decision that obviously, I would say we are partnering with Atrium, and it's more in a data sharing and information sharing, whether it's on virus, clinical data points or updates, things that we're learning on a real-time basis. Or whether it's managing hospitalizations or a variety of things. So we are a real-time partner with Atrium, and we communicate with them regularly. It was an Atrium corporate decision to have the locations that they've chosen to do public administration. When I say what's important there is that they communicated that to us very early on in the process, so that we have been able to, again, communicate that to our community, or begin communicating that to our community, and to base our plan around recognizing that we're the only entity doing public vaccinations in our community. So it's not something that we requested that they do. It's something that fit their business model based on their dosage allocation and their available resources. One thing to keep in mind is no one, including the hospitals or the Cleveland County Public Health Department, is built to manage a world pandemic. This is the pod that we did on the 20th over at Crest High School. We vaccinated 750 people that day, included 18 county departments, from traffic control to registration. It takes 28 people to run one of those pods, and when we're resource allocating how we're going to make that happen, there's no particular situation in which we can clearly and easily meet that demand. We have people from various departments, from travel tourism, from planning, answering phones. We have people that are raising their hands, wanting to be a part of the solution. And I really just applaud our employees here. I think that the response to us asking for folks to step out of their norm and do not only their day job, but also help push this as the top priority of Cleveland County government right now. And from the support that we've got from the Board of Commissioners level all the way through all of our staff, I just applaud the response, and please recognize that it is a tremendous resource allocation. And I hope that's something that's well received.
Okay, this may be best for Ms. Hanson. Have you thought about implementing online vaccine appointment registration?
So vaccine appointment registration is something that we're considering as we move through the phases. We haven't currently launched it, as Brian mentioned, because we're really trying to prioritize Cleveland County residents and utilizing and assessing the mail-in, phone, and email platforms. And so as we continue to strategize and move through those platforms, it is something that we are exploring as well.
Just to clarify on that, so with limited dosage allocation, so for example, we found out last night, next week, Cleveland County as a county will only receive 300 additional vaccine doses from the state. If we had an online platform, this is a North Carolina vaccine, meaning that anyone from anywhere, Mecklenburg, Gaston, Henderson, Catawba, Rutherford County could go online and take those appointments. And when it's such a commodity to have only 300 vaccines for a community our size, we just thought that it would be very advantageous to try to reserve those for folks who live in Cleveland County. And that's much easier to do without having just an open sign up. And again, there's 25% of our community that may not have access to online sign up, and proportionally that may put them at a little bit of a disadvantage from an equity perspective.
Okay. There's a question, I'm 74, emails for an appointment, after not being able to get through on the phone. I have not received a response, should I email again?
So the email lines also align with when those phone lines are open. So typically when the phone line is open, the email is also open at that time. I would say continue to watch our social media pages, our news channels, and follow the county's website for additional pop-up vaccination clinics. I know for this week, all of our appointments are allocated out, but I would just encourage you to watch for additional ones and then send another email when those open up.
Okay. My son has healthcare workers who come in to help with personal care and community, and those people can cause extra exposure. How can we help control that?
So one of the things that you can do is for those individuals that come into the house, their companies or their entities that they work for likely fall into group 1 eligible recipients. So I would encourage the facilities that they work for to reach out to us at the health center if they have not been vaccinated to be able to arrange that. Internally in your homes, a lot of it still is just focused on disinfecting and wiping down surfaces, wearing masks and gloves, and really just trying to limit the number of contacts inside the household and the number of people leaving to go to alternative places, grocery stores, schools, and trying to limit the number of people that are frequenting multiple places throughout the community.
Okay. Why has less and less information about COVID-19 infection status been given to our community, both on the local level and on the state level? It seems that if more information were given out locally, some of the people that are not taking it serious might be wearing masks.
Sure. So we've really transitioned statewide to relying on the NCDHHS COVID dashboard. It's very robust. It breaks down demographics, vaccinations, our cases, our positivity across the state and Cleveland County. And so for us, we share that dashboard on our updates 3 days a week, as well as encourage anyone calling through the helpline to also frequent those sites. They have an immense amount of data on there that we really want people to take advantage of, and we want to direct them there because it has the most accurate data than any other sources that we're collecting from.
So folks can find that link on our website. Right?
Yes, and we actually update it and share that link Monday, Wednesday, Friday as well, along with kind of Cleveland County specific data that's also housed on that dashboard.
Great.
There's a question about how do you handle when someone selected has already received the vaccine? If you send a letter to somebody, if they've already received the vaccine from another location or is not eligible, they will be eligible because they currently are sick with COVID or they have already received the vaccine. How do you handle that if they have a letter?
Well, interesting. So a couple options there, and I think that. We experienced that the proactive and all the bonuses of sending the letter that prevents folks from that A, prioritizes Cleveland County citizens, that B, ensures that everyone is included regardless of their social demographic status or their access to communication or internet. It also avoids long wait lines on the phone. One of the downsides is that you're not necessarily sure that someone hasn't already been vaccinated or that they want the vaccine. If you're simply going chronologically based on geographic location and age eligibility and inviting people to participate. So that is a downside, and that's what, as I mentioned earlier, something we anticipated but didn't know to what level to anticipate until yesterday, which was our first one, and tomorrow will be our second one. And as we learn, the data is fluid, and we are required to adjust on the fly to make the best decisions that impact our community moving forward at a macro scale. But in the meantime, if someone receives a letter and they have indeed already received the vaccine, they don't want to take it, or they're not outside the 30-day window of being COVID positive to receive the vaccine, I would encourage them to potentially give the letter to someone else who is age eligible, meaning they know someone else who can take the vaccine, who is above 65 or above, and just give that person that letter, tell them where to go and when. Make sure they know their name, and when that person shows up at the pod distribution center, so for example tomorrow, they would say, I've taken X, Y, person X's spot. Here's my eligibility, and here's their letter. And then we'll move them through the vaccination clinic. Again, the most important thing is that we're putting doses in eligible folks as quickly as we possibly can. Other questions, again, I hate to tell folks to call the COVID helpline, but just know that we have anywhere from 7 to 15 people full time doing nothing but trying to answer your questions. And one of the challenges is not only are we receiving 2,000 phone calls per day, and that was as of yesterday, what we're experiencing is when people finally do get through, they don't only want to ask about vaccine, but they also have questions about family members and questions about work and questions about church. And as a matter of priority on customer service, our folks are really dedicated to spending as much time with that person as we can. So it's not only the volume of calls, but it's also the length of calls. This is hard for everyone, and I think we are all being impacted. We're all learning. It's not business as usual for anyone. And just here that, again, it's our top priority at the organizational level for Cleveland County government, Cleveland County Public Health, and we're dedicated to answering as many questions as we can.
What are the hours the phone line is operational?
So the COVID helpline, the 5316 number is operational 8 to 5. The vaccine scheduling line is only operational when we post on Facebook or social media or whatever those outlets are going to be until appointments are filled. And so it varies in times. It can vary from 2 hours to 5 hours, but it only is staffed during the times that we host those pop-up vaccination clinics. Once all appointments are filled, those lines are then, repeat that message that no appointments are available and the staff are not watching those phone lines.
And that's intentional too, Tiffany, because we want to be careful to not schedule more appointments than we have vaccines for. So as we are hopeful that our vaccine allocation from the Health and Human Services Department at the state goes up, then those phone lines will be open more. Is that an accurate statement?
That's correct.
Is the county health department receiving the vaccine from the state or from the manufacturing facility direct?
So we receive our allocations from the manufacturing facility specifically, but our allocation determination comes through North Carolina Department of Health and Human Services.
Meaning they determine how many doses we get, although it's shipped from the manufacturer.
Correct.
What was your turnout at the clinics from mailing the letters? I think we've already addressed it.
Yeah, it was about 50 or 60%.
Okay. How are you reaching eligible people who are homebound? Have you considered allocating vaccines to existing community-based medical teams to organize that and reach those people?
Yeah, so our incident management team is still strategizing on homebound residents and how likely we are going to capitalize on the community paramedic, some of our public health nursing staff, as well as community partners, and we're strategizing what that's going to look like moving forward.
Can you maybe share the fact that right now who can actually distribute who can give the vaccine?
Right. So right now there's some limitations because only approved providers can actually distribute COVID-19 vaccine in Cleveland County. And at this point, only Atrium and Cleveland County Public Health Center are approved administrators. And so that's creating some limitations. We cannot redistribute vaccine to anybody else within the community because they're not an approved provider.
Can you just readdress how where you communicate the pop-up vaccine?
Yeah, so currently the pop-up vaccination clinics are being communicated on our Facebook, social media pages, as well as the county's website, so clevelandcounty.com. Is that right?
Mm-hmm. Yeah. People in group 1 are being skipped over because they haven't received a letter. Can you talk about how you're addressing those who qualified under group 1 but maybe haven't been vaccinated yet?
Yeah, so if you're a group 1 eligible recipient, so these are healthcare workers doing direct patient care or long-term care staff and residents, you can call the COVID-19 helpline, which is our 980-484-5316 phone number. And they actually keep a running list, first come, first serve, of our group 1 eligible recipients. And then we work those into appointment schedules as allotments allow.
What is your advice for adult children out of state trying to help their elderly parents in Cleveland County obtain a vaccine? If they have not received a letter in the lottery, do they just keep calling to see if new appointments are available when letter appointments are not being used?
I would say they can call our helpline, follow our Facebook pages, watch for those pop-up vaccination sites. If you're out of state, you still are able to access those. They can call in and schedule an appointment for their elderly parents as well, utilizing those platforms too.
So just a clarifying point there. The letter system to this point has not been lottery. It is very chronological based on voting precinct. For our Burns Middle vaccination pod, there's about 9,500 folks who vote in a precinct in the northern end of Cleveland County. So we're able to simply align and sort 9,500 folks and either start with last name A or last name Z and work chronologically through the process. So if we stick to that model, meaning if tomorrow's outcome as far as engagement and turnout is different than we experienced yesterday, and we stick with the model because the data allows with mailing letters, everyone will receive one at some point. And we're going to stay consistent with mailing the letters. I'm just saying the strategy may change slightly to make sure that we're maximizing our resource allocation when we do the pod systems. But it's not a lottery system, number one. And then number two, the pop-up clinics, even with the letter, will be required simply because we are mandated to liquidate those dosage allocations from the state within 7 days of receiving them. And oftentimes that isn't enough time to process. For example, we can't, as we mentioned earlier, have phone lines open to take appointments when that in our appointments exceed our dosage allocation from the state. We also don't want to send more letters than our dosage allocation may allow. And so, we found out last night at 9 o'clock what our dosage allocation is for next week, and we have between now and this time next Thursday to figure out and plan a distribution point and get folks signed up. So, the timing there really squeezes how the communication style should be, but it really is imperative just to pay attention to both Facebook and the website for pop-up opportunities. And in the absence of that, at least for this point, there will be a letter mailed depending on location and name. And again, that's one of the benefits of this type of platform, which we are be hosting again 14 days from today at 9 o'clock, is if something changes with that strategy, this will be one of the platforms that we use to address that and announce it.
What about the vaccine for the people that don't show up, the ones that get letters? Do you provide for others to get those on that day?
So as Brian mentioned, for those individuals that don't show up, those doses are reallocated by appointments to other individuals that are eligible.
Can you talk about, again, just asking the question, why you don't take all phone calls and arrange appointments simply by age?
I think part of it really is it's very labor intensive for us. I mean, like Brian mentioned, we have around 7 to 15 people taking upwards of 2,000 calls a day. And so in order for us to take all of those phone calls and really efficiently work the process, we felt like that was not the best use of that time. And so we take as many phone calls as we can and allocate the number of doses that we have. We realize that we have an extremely limited amount of doses, and so we want to be mindful to that as well. So we're managing and strategizing as we move forward to be able to take additional phone calls, but we want to be as consistent as we can be with our dose allocations as well.
So I think we got time for maybe 2 more questions.
Okay. Is there a way for Cleveland County residents who are in another state to get vaccinated?
That's a good question. So really, if you're a Cleveland County resident, you'd likely have an address here potentially. And so, and if you're a registered voter, you'll receive a letter in the mail. If there's somebody checking your mail, they can at least notify you that you've received the letter. If you're able to make it back and could participate in one of our pop-up vaccination sites, I would encourage you to continue to watch our Facebook page and our website. So if you're able to make it back to one of our locations, you would be able to sign up via that platform as well.
Or certainly, if you're, depending on what state you're in, you would follow their guidelines, their framework, which will be very different than North Carolina. And maybe that's a good thing.
Okay, one question on here is, will this presentation be available for viewing online later? And I know we are recording.
We're recording this, it'll be posted. And then again, in 2 weeks when we meet again, we'll try to have updated data, updated information for educational purposes. So each of these, and I'm looking at our IT folks, each of these are recorded and a link will be posted. Is that right? Very good. Well, that's concluding our time for this morning. I'm going to ask Commissioner Bridges for anything that he may want to say and to close us out. And again, we just thank each of you for your time. We'll talk to you in a couple of weeks.
I'd just say that the citizens of Cleveland County should be very proud of this team we have. Putting a whole lot of resources on this one item, but at the same time, the county's still open. If you need a birth certificate or have a tax question or something, you know, Cleveland County's still open, and all the employees are working very hard. Even as the health department, with all they got going on, they're still going out and checking the restaurants. The one I'm affiliated with, you know, we wear a mask all day and constantly clean, and the health department is behind this, making sure that everybody's doing what they need to do. And if there's a good thing in all this, we probably have close to 10% now of people that have either had the vaccine or have had the coronavirus. So we've started our herd immunity, and we just need to keep on working and doing the things we know to do. Wear a mask, stay 6 feet apart, wash your hands often, and that's just, I think we can all work together and get through this. So thank you.
Thank you. Take care.